Excited to be here. This is week 7 of our 90 days to healthy hair. And this week we are going to focus on inflammation. Why is this important? It's important because inflammation creates a lot of issues that we oftentimes are not aware of, and it absolutely impacts our health. So inflammation is not just about feeling pain or discomfort. It happens inside of the body, and it affects our hair as well, deep down in our follicles. So if we look at how what we call systemic inflammation can interfere with hair growth, as well as how scalp-specific inflammation can lead us to hair loss. Now, we're going to talk about the difference between systemic hair loss or inflammation, as well as our scalp-specific inflammation, because each one is important and they impact each other. So here, one of the things that can happen is as our body weight increases, it can lead to higher levels of inflammation. And this is something that we often are unaware of, but it's really important because these metabolic issues such as insulin resistance and it further elevates these levels. By making healthier choices in our diet and exercise, we can help lower these levels. Now, this is important because when our inflammation increases, it also is a sign that our cortisol levels are increasing. And that combination is not good in terms of our health. So when the body is inflamed, the hair feels it. Even when the scalp appears calm, internally, inflammation can tell another story. And this is important because that chronic inflammation, our body was built to deal with a certain level of inflammation, and that would be short term. But when we start dealing with long-term inflammation, that is what we call chronic inflammation, and that is what we call systemic. So our body deals with short-term inflammation like fight or flight. The body is trying to determine what should it do. Should it try to fight off what's going on? Or in the case of our hair strands, do they take the path of flight, which means they begin to shed excessively? And this is where we really run into a problem, because this chronic stress, poor sleep, high sugar diets, it all disrupts and raises our hormonal cortisol levels. When our cortisol levels are increased, then we disrupt the growth cycle of our hair, because it all has an impact down in our follicles. And so when we are dealing with this, the result is thinner strands, slower growth, excessive shedding, as well as dullness and dryness. So sometimes people are often feeling that no matter what they do to the hair, even when they consider that they have gotten their hair in what they would consider good condition, the hair is still dull. The strands are still thin. And when you have thin strands, they are fragile. That means they're growing through this stress. And in the process of growing through this stress, those strands are very weak. So this is what I see when clients are coming in, and we even go through the process of trimming away what at that time is unhealthy hair, doing conditioning, and we're continuing in this process. The client is assuring me that she is doing everything at home that we have talked about, but we are still dealing with this unknown factor that is causing the hair to break. This often is because the hair is growing through a stressful setting and growing in spite of that inflammation. The strand is growing, but it is growing with all of these markers such as thinner strands, slower growth, excessive shedding, and dullness and dryness. Your hair becomes a reflection of what's going on inside your body. So all of that is important because we may be doing everything that we know how to do, but if you have not managed that stress, you have not gotten that inflammation to a manageable level, you're going to continue to struggle with the hair growth process. Now, many of you that are dealing with hair loss in some form or fashion, inflammation is there. So it doesn't matter what kind of hair loss condition you are experiencing. Inflammation is in every kind of hair loss. And that's why we're talking about it today. It's really important for you to understand how urgent it is for you to manage your stress, to get your healthy eating habits in order. Why? Because there are many triggers, and we're going to talk about even the food triggers that can trigger this inflammation in the scalp. So here we see that when inflammation silently sabotages the hair growth, let me turn this a little bit so you can get a better view. Deep beneath the scalp, each strand of hair is growing from a tiny living follicle. This is very intricate, and it's a microenvironment that thrives on balance. When that balance is disturbed by inflammation, unfortunately, those strands cannot coexist with the inflammation. So now you can see this inflammation is here, and it is restricting the blood flow, and it's reducing the oxygen. And hair needs oxygen, nutrition, and a free flow of blood into the follicle to stimulate the growth so that hair will continue to grow and thrive, and the cycle of growth can continue in its full phase. But when this inflammation is present, that cannot happen. And this here you can see how all these reddened areas are showing you how this inflammation is literally choking off the hair strand in a way that it is not able to thrive. And this is often what occurs when you are trying to figure out why your hair is not growing the way that you want it to, why it's not growing the way that it used to. And even if you are under the doctor's care, you're doing everything that should be done in accordance to topical and medical pharmaceutical drugs, whatever it is. Sometimes it's low-grade steroids, sometimes it's anti-inflammatory shampoos. Now, what I want to talk about is often if you are going to a dermatologist, one of the things that they often prescribe is an anti-inflammatory shampoo. Now, you might know it as ketoconazole in the little white bottle, but it will have a red appearance when you pour it out. Now, this is to be focused on your scalp. Often, as people are using this type of shampoo, because it is a therapeutic shampoo, and one of the main focuses of it is to reduce inflammation. You may feel that it's making your hair feel drier, tighter, and less manageable. And so what I have found is oftentimes clients stop using that shampoo, even if they're going to their stylist, because of the way it makes the hair feel. But you've got to continue to use that shampoo, because that is one of the main external factors that can help you to manage, maintain, and control any inflammation that is happening at the scalp surface. So what I recommend that you do, if you have some type of prescribed shampoo, which would be prescribed for you to use at each shampoo phase, whether it's weekly or bi-weekly, you should focus that on your scalp. So part the hair and apply a little to your hand, and make sure that you're putting it on the scalp. What you often may be doing is using it in the way that you would normally use a shampoo, pouring it into your hand, rubbing it together, and then putting it on the hair. But your focus and your goal should be the scalp, because it's there to reduce inflammation at the scalp surface. And by the way, as it works its way down the hair shaft during the massage and then the rinsing phase, it does come in contact with the hair. What you should do after using that for your first shampoo, make your second shampoo a conditioning, softening shampoo. So you would use your prescribed shampoo first. That's going to help to reduce this inflammation. It's going to calm the scalp. And some of you, when you have inflammation, you might also experience tenderness at the scalp. You might experience itchiness at the scalp. These shampoos are designed to address all of those scalp concerns, because the scalp is the fertile ground where the hair is growing from. So we definitely need that scalp to be healthy as possible. So use that for your first shampoo and use a conditioning shampoo, something like the Clean Cuticle shampoo or whatever type of softening shampoo that you have that's more, when you look at the label, it'll say moisturizing, which is going to provide a softening effect on the hair, and that is going to make it more manageable. So as you get past your therapeutic phase of treatment, when you're doing your having your regular wash day, then you move right into the conditioning phase where you're softening the hair, making it manageable again, and then moving into your conditioning phase. So as we can see here, we talked about how the inflammation builds up and it constricts the hair strand as it's trying to grow. It constricts the blood flow, and we need that blood flow, and we need that oxygen, that air. Nothing can live without air. So we need oxygen, nutrition, and blood to promote the hair growth process and to continue it as the hair continues to grow down here in the follicle and it appears up here at the scalp surface. When that inflammation is present, it is reducing the nutrients also. So the nutrition, what you're eating daily, any type of supplements that you're taking, it cannot get to this strand no matter how much you try. If that inflammation is present and you have not used something to decrease it, then it is going to win. And that means it's going to shrink the follicle, it's going to miniaturize the hair strand, and eventually that hair becomes to a point where it grows slower, and eventually it stops growing altogether. So now you can see the importance of understanding what's going on with inflammation. So when we talk about the two different kinds of inflammation, the main type that is most dangerous for our bodies and our hair is what we call systemic inflammation. And this is where we can focus on lifestyle and habits. We can change that inflammation that's occurring in our bodies because there are a few things that we can do. At least we can focus on not contributing to more of the inflammation. When there's stress, when we're not eating properly, when we're not getting proper sleep, we're not managing our stress, then it's going to allow that inflammation to just run rampant and take over that hair strand. We want to make sure that we are doing a checklist, making certain that we're eating the right things, we're sleeping well, we're getting at least 7 hours of sleep, which is almost so difficult to finally make that happen, but we need to do it. Why? Because your body heals while you're sleeping. So if you're not in deep REM sleep between 2 and 4 a.m., then the healing process that your body needs to thrive, to renew those strands and to reduce that inflammation with all the other things that we're doing, that hair cannot grow. That's when we heal. That's when the cells turn over. And that's when they renew themselves. Our body is this amazing tool, this instrument, the way that we have been made so that our bodies can renew, revitalize, revive, and can have an ability to renew itself. But this typically does happen while we're sleeping. Now, when the body is inflamed, we talked about the results that we have, and we talked about the unfortunate end results. Inflammation comes with chronic and systemic types of effects. It starts damaging healthy tissues and it interferes with the body's normal function. So now it's getting serious. We're talking about how this inflammation impacts our entire body from head to toe. Cardiovascular disease, type 2 diabetes, cognitive decline, which is brain fog. Unfortunately, we're seeing so many people with cognitive decline, Alzheimer's, different things like that affect our ability to function in society and take care of ourselves, hormonal imbalances, hair loss and poor scalp health, joint and muscle stiffness and pain, and accelerated aging and fatigue. All of this comes as a result of inflammation. That's why it is something that we all need to be aware of, and we all should be checking for it to see how we can improve our overall health and well-being. So how do we reduce this type of inflammation in the body? We want to eat healthy. And actually, we've talked also about our hormonal changes and how our bodies experience change when we're in perimenopause and menopause. These recommendations are actually the exact same recommendations that you would follow to have a healthier experience during those hormonal changes when estrogen is declining. So you want to eat anti-inflammatory foods like fruits and vegetables, omega fats, fatty acids, our salmon, our flaxseed, green tea, turmeric, and ginger. All of these things are anti-inflammatory. So yes, there are some things that we can do that does not require us to get a prescription. These are things that we can do because all of what we see on the outside starts on the inside. Hair, skin, nails, everything. We have to start with building our body with a good foundation so our health is at a good level and we are seeing the right kind of improvement. We need to move. You know, I'm guilty myself. We don't always have time to do those 10,000 steps or that 20 minutes of exercise. But we have to figure a way. I was talking to a client this morning, and that was something that she was sharing. She has started doing Tai Chi, which is an Asian exercise that renews the whole body. You start your morning with it. You start off by